My name is Amy Peperato. I live with my family in Thiels and I practice medicine in West Haverstraw, New York. I'm here today because my 4-year-old son has epilepsy and I'm appalled that New Yorkers do not yet have legal access to medical marijuana. The Compassionate Care Act was signed by the governor in July. In the past 5 months, not one patient has been able to register. There are no registration forms available. Not one physician has undergone the mandatory training outlined by the law. The program is not in place. And not one cultivator has been given the green light to start growing.
Yesterday, the governor issued the regulations for the program. There was nothing in those regulations that will provide immediate relief to these families. And so they've come out today in the cold, they've come out today in the frigid weather to tell their story and to ask the governor to have compassion, to do the right thing, and to grant their holiday wish of providing emergency access.
After more than 5 months and the deaths of at least 3 children waiting for medical marijuana access, I'm very sad to say that Amanda is struggling badly with her seizures and there's still no end in sight. As any concerned parents would do, we're seeking out every potential option we have with her seizures. We got accepted into a clinical trial and we jumped on this opportunity. However, it's not in New York, it's in Boston, so we will travel 4 hours to get her this access. It is my worst fear as a parent that my child will be next. That's it. Thank you. To add insult to injury, the federal government recently denied a petition to allow us to get this medication from states where it's legal. Do you know what has happened in those 5 months? New York children have died from seizures and cancer.
I have an older sister, Melanie. She passed away when I was 3 years old from a very rare genetic disease. She was 7 years old. I can only imagine how medical marijuana could have eased her pain before the end of her life. I've already lost one sibling, and I shouldn't have to lose another. I don't understand how an outdated stigma about marijuana is what's delaying my brother from getting him the medicine he needs to survive.
After 4 hospitalizations with seizures lasting over 20 minutes, we got the test results indicating that Vincent has Dravet syndrome. He was 6 months old. With high doses of 2 different anti-epileptic drugs, there is a 13-month period with no seizures. The trade-off with significant side effects. Side effects no parent would ever wish on a child, except when the alternative is even more horrifying.
I'm a lawyer. My baby, Emma Rose, passed away. She was 74 days old, and she was diagnosed when she was 6 weeks old with Ohtahara syndrome, which is an early epilepsy disorder. She suffered hundreds and hundreds of seizures a day, and no one could know what these parents go through. So the doctors would come see us daily. We were at Columbia Presbyterian, one of the finest hospitals, and we heard about marijuana, and it was just not an option for us. If they could have stopped the seizures, there could have been a chance that at some point, like many of these children, the brain can regenerate and there's hope.
Up to 50,000 Americans die each year from epilepsy, and at least 3 children in New York have died from seizures since Governor Cuomo signed the Compassionate Care Act. What could possibly convey a greater sense of urgency than having a child's life hang in the balance? As a parent, I'm angry at anyone standing in the way of meaningful access to this plan. A plant that has no more and often fewer side effects than the current FDA-approved drugs used as anti-seizure medications. As a doctor, I'm actually hopeful, as the more I read, the more I see the tremendous potential benefits of adding cannabis to our medication arsenal.